Hi, everyone. Welcome to this episode of the Autism Annex podcast. I'm John Andrew Slominski, and I'm glad you're with us. Earlier this year, we explored occupational therapy for children on the autism spectrum over the course of 2 episodes. First, I spoke with Kayleen, whose son Dominic has autism, about their family's experience with OT. And I had a conversation with Kristen Whitmire, Dominic's occupational therapist. On today's episode, we'll get back to that discussion of movement, and we'll talk about how physical education and sports can be both beneficial to and inclusive of children with autism and other disabilities. My guest is Dr. Martin Block, Professor of Kinesiology at the University of Virginia. Dr. Block has spent more than 30 years teaching and researching the philosophy and practice of including students with disabilities in general physical education. Dr. Block, kinesiology is a new topic for us on the podcast, and I'm excited to have you here.
Great, yeah, I'm excited to do it.
So, kinesiology 101 question here, if you don't mind. What do kinesiologists study, and what sorts of things do you think about?
So it's a kind of a sciencey name for the study of human movement. So our department has people who study exercise physiology, so how you exercise and how that affects your heart and your lungs, and working with people with diabetes and other conditions. We have sports medicine people here who study athletic injuries and how to rehab athletic injuries. Again, my area is physical education and physical activity specifically for children with disabilities. Most kinesiology programs, ours doesn't anymore, but they have general PE to train people to be regular PE teachers. Some have sports management as a discipline, sports history, sports sociology, sports psychology. So it's a broad umbrella term for anything to do with sports and physical activity and enhancing someone's ability to move and prevent diseases and recover from diseases. So that's kinesiology in a nutshell.
And in a field of so many possible specialties, what's the story of how you came to choose disability and inclusion for children with disabilities?
Yeah, okay. I always wanted to be a PE teacher. I loved sports growing up. I played sports, and I went to college. I knew I wanted to be a PE teacher. But then I also thought maybe there's a little bit more I could do than just being a general PE teacher. And when I was going to school in the early or mid-1970s, I was in North Carolina, and my town had a school for the deaf. And so I decided to volunteer there and work in the phys ed department and help coach. And I absolutely loved it. And then I thought the next year, well, maybe I could expand and try something different. And there was a school for kids with intellectual disabilities and autism. So I volunteered there, and I loved that. And then there was a school for kids with physical disabilities, and I did that. So it's kind of like just experimenting. I knew I wanted to, work with children, but I didn't realize I would love working with children with disabilities until I got into those settings. So that's kind of how that started. And then I went to Ohio State to get specialized training in adapted physical education, and then I got a job in Northern Virginia near Washington, D.C. at a special school and taught there for 5 years. I loved working with kids with disabilities. I still do. So, and I coach tennis Special Olympics in my community, and I love playing tennis and sharing that with people. And I also coach volleyball Special Olympics. Both of my daughters played volleyball in high school and college, and so I became a good kind of a coach for kids while they were growing up. So love coaching, love teaching, but yeah.
Marty, I'd like you to take us back to that period in the 1970s when you were starting your studies. How did physical education look for children with disabilities during that time? And how have things changed since?
Yeah, great question. And it's a huge difference. So when I was being trained, all the children were in special schools. And my first job was in a special school for children with disabilities. And then and so we had physical education was provided in these special schools, but rarely were children with disabilities included into regular schools. And then in the late 80s and early 90s, there was a slow push for inclusion. And so we started seeing more and more children being in general education, including general physical education. And that's when I kind of shifted my focus and my research and interest in how can we help PE teachers better serve children who were included in their classes, because they just didn't have the background or training. At the same time, I also realized that youth sports coaches were starting to see children with disabilities going to regular soccer, regular t-ball, things like that. And again, they didn't have the background. So that's kind of the big landscape change was from special schools to really inclusive setting. And then I would say in the last 15 or 20 years, we've kind of had a pullback a little bit where we have special schools for kids with autism. That's just such a unique population and needing some unique needs that may be best served in a special setting. So I think that's the type of thing that I'm seeing. So a shift from special schools to like full-on inclusion now back to, well, maybe these kids would be better served in a special setting for part of the day, but then included in other areas where it may work. So yeah, that's kind of the shift.
So during this shift that you're describing, over 50 years or so, what have we learned about the specific challenges that children with autism can experience in sports and physical education?
So they present some really unique challenges. I was doing Special Olympics yesterday, working with a young man with autism and trying to help him with some tennis. But the unique challenges are kind of multifaceted. So one is just motor and coordination problems. There's been more and more research that suggests maybe as many as a quarter or a third just have some movement problems. So you have the motor coordination issue is something we know about. We have this understanding and motivation and paying attention issue. Then you throw in some of the social issues that children with autism often present. So now I say, I want to put my son in a t-ball league. Well, there's lots of other kids who are going to be interacting there, or a little league soccer program, or a little league basketball program. And the whole idea of interacting with kids and reading kind of these nonverbal things like pass the ball to me and how to move and get open, and just huge challenges for kids with autism. And then there's some other research that children with autism tend to enjoy screen times. We know that, watching videos and things like that, playing video games. But that leads to a sedentary lifestyle. So there's some new research that suggests a significant number, maybe, again, 15, 20, 30% of children with autism are prone to sedentary behavior and obesity and some issues like that. So now you have someone who has some coordination issues, might be a little bit overweight and not very fit because they're not very active. They have trouble paying attention. So let's put them into a physical education setting with 50 other kids. I mean, that's just like a nightmare for that poor little boy or girl. Or let's put them on a little league softball, little league baseball program. Again, just a really challenging situation. It can be overcome, but those are some of the challenges. I'm sure if you talk to some of the parents who are listening, they'll say, oh yeah, I can see how that could be a challenge.
Right. And I have to imagine that noise alone can be a really significant issue for some kids.
Oh, absolutely. The noise, all the people. Yeah, it's just a really, we have a lot of kids who come in with ear mufflers into the gym setting because it's just so noisy there, and just so that's certainly something that helps. So yeah, so one-on-one seems to work. Smaller groups sometimes works, and we try to put those kids in general PE, but with the idea being what's the best for the child. So I want the child to benefit from whatever setting they're in. Benefit meaning learning motor skills, enjoying being physically active, being successful. And if that could be in a general PE setting, that's great. But if that can't happen, then certainly a small group or one-on-one may be necessary.
From your perspective, when you're looking at the state of physical education right now, what are some of the major barriers to meaningful inclusion, especially for students with autism or other developmental disabilities?
So I think the biggest thing, and this is something that we've been observing and finding for years now, but I think the biggest thing is that the child with a disability is kind of left out. So this is what you may see in a PE setting. You see a child with autism coming into regular PE, most likely accommodated or going in there with a teacher assistant from his classroom or somebody helping him. And the PE teacher, it seems like the child's in there. It seems like the child might be moving, but in reality, behind the scenes, the PE teacher isn't really interacting with the child. The PE teacher isn't accommodating the child and coming up with some solutions. And I think a big part of it is the PE teacher sees that teacher assistant and says, oh, great, Johnny's being taken care of. I don't need to worry about him today, that the teacher assistant has him. But the teacher assistant may know Johnny really well, but doesn't know anything about PE or what you're doing today or how to accommodate the child. And so there's this kind of a disconnect. And one of my doctoral students just did some research on teacher assistants and PE teachers, and there's just such little communication between the two. And so I think that's one of the things behind the scenes that it's subtle, but it's, for someone like me, I observe it and I see it, it's like slapping me in the face. Someone else might say, well, look, he's in general PE, he's doing great. No one's talking to the child because he's with the teacher assistant. The other kids are busy moving. The PE teacher is busy directing everybody else. And so the teacher assistant with no experience is directing this child's PE experience. And that's to me not successful, not working.
Well, and what you're describing sounds to me like educators dealing with a lot of moving parts, right? To the best of their abilities, but that certain things like communication and maybe overlapping skill sets or lack thereof just leaves many students behind. How do we do better?
Yeah, great question. So I think a couple things. I think we need to do a better job of preparing the PE teachers. I think that's one thing. Is that this has been going on for years that these kids are included in general PE. So we kind of have lost the excuse of, well, I've never done this before. I had no idea I would have kids. You're going to have kids, and they know that. But during their preparation in undergrad, they have one course in adapted PE as part of their training. And that tends to be a survey course, like what is Down syndrome, what is a spinal cord injury, what is a visual impairment. But they don't really get into, all right, you have 30 children in your PE class. You have 2 children with autism. You have a teacher assistant. How are you going to help these kids with autism be successful? That's the piece that we're not giving the PE teachers. Or if we do, it kind of goes in one ear and out the other. And when they go to teach, they've forgotten all the things they've learned. So I think in-service work with PE teachers, maybe creating little online modules that they could pick up. For example, I think your audience knows very well that visual supports are just terrific with children with autism. So I created a little module for PE teachers on how to create visual schedules, how to create little visual timers, how to create like task organizers, like the steps for throwing or kicking, and then be able to present that to the child when he comes to PE so he knows, okay, first we're going to do this, then we're going to do this, then we're going to do this. So just those types of things. So I think if we can present those types of things to PE teachers, I think that would help them. And again, I'm very aware that our PE teachers are teaching back to back to back kids, and they don't have a lot of time to create these things. But I'm absolutely sure that if they went down to the special ed teacher and said, can you please create me a schedule for PE? Here's some of the things we do. We do a warm-up. We do running laps. We do some fitness activities. We do these types of... She'd be happy to create it, laminate it, give it to the PE teacher and say, here you go. And the PE teacher would be all set. So the other piece that I'm getting ready to write about this right now is the communication between the special ed teacher and the PE teacher. So let me help your audience see this or imagine this scenario here. So I'm the special ed teacher. I have a special class of 6 children. I have 3 or 4 teacher aides with me. And I look at my watch and say, okay, it's time for Sarah to go down to PE. Mrs. Johnson, will you please take Sarah to PE? All right, so Mrs. Johnson takes Sarah down to PE, and the special ed teacher doesn't communicate at all with the PE teacher about these are some of the needs Sarah has. These are some things that you can do to help her have a better experience. And I don't really think that the special, and I'm trying not to blame the special ed teacher, but I don't think the special education teacher says to Mrs. Johnson, hey, let's take Sarah down to PE. Let's focus on these things. Let's really work on trying to get her to interact with peers. Let's try to really get her to be really active. I know she likes to sit on the bleachers. Let's really see if we can get her to be active. That conversation I don't think happens either. So how can we get that PE teacher and the special ed teacher, most likely before school or after school, to communicate, Sarah's going to be in your class. She's your responsibility. Here's some things you can do to help her be more successful. And I'm going to check in with you once a month and just kind of say, hey, how's Sarah doing? Are there issues you're having or things I can do to help you as the that type of stuff. So to me, it's that communication or the lack of communications that's setting up these kids for failure, unfortunately.
What you're saying in terms of visual supports, schedules, and task organizers, all of these things are part and parcel of evidence-based practices, and we know they work. And I'm sure that some educators are listening to this and thinking, hey, great, we'd love to have more communication, but, I'm swamped as it is.
And again, I know that special ed teacher is swamped. I know the PE teacher is busy, but somehow we got to, in terms of resources, give them time to communicate. And I'm not sure who would dictate that. It'd be the director of special ed or somebody. But I just, to me, that's the communication piece and the meeting piece. And just, imagine the PE teacher coming to the special ed teacher's room for 15 minutes, once a month, and just saying, hey, I've been having, fun with your kids. So are some things I need to know, some things that can help me. Like Sarah just kind of wanders around and really doesn't interact with anybody. What there's some things I can do, so the PE teacher knows what's going on, and the special ed teacher might not have any idea that that's happening. The special ed teacher says, yeah, I have some great ideas. We can do this and this and that. So I'm really, I really think that communication piece. Now, how we can get those people together, that's the challenge. But man, that's going to be the gold that you need to get done.
We know that resources, including time, can be scarce in schools, and that is a major hurdle. But when students with autism and other disabilities are included in PE, there's not just a clear benefit for them, which you've described, but also for their neurotypical peers and even educators.
So the student with autism, let's say, will have a chance to interact with peers. It could be, with peer tutors. It could just be being part of a group, something like that. Just those interactions and opportunities for social interactions, I think, are really positive. Getting the child to learn to follow some directions, stay with his group, stay with the class. We talked about the sensory overload, learning how to deal with those sensory situations, because when you go to a grocery store, when you go to Walmart, it's going to be noisy and busy in those places, So, I think being in given those opportunities, that would be really, great as well. Just the physical benefits of being physically active, physical fitness, developing motor skills. And then we look at the kids without disabilities, what benefits they have. Well, they certainly have a chance to interact with children with disabilities who they may not have had a chance to do. They may have a chance to be a peer tutor and really get to know a child a little bit more closely and dispel some of those stereotypes they might have had. And then you look at the physical education teacher, all of a sudden I'm learning how to accommodate a wider range of abilities. I was teaching to the middle, and all of a sudden with this child with a disability, I realized I have a lot of children who are kind of struggling and need extra attention, or may need different ways of doing something, or offering them different size balls and lower baskets, because I have some other kids who are not doing very well. So I think they benefit from that environment as well. So there's just a ton of benefits for everybody, the child with autism, the child without who's in that class, and the PE teacher, who really can learn a lot and have a great successful experience.
And as you said earlier, too, PE and sports can have a huge impact, not just on our physical lives, but also on the social emotional side of things.
Yeah. I didn't even talk about those social emotional learning pieces, which are just so prevalent in a PE setting. How do I handle winning and losing in a nice way? How do I work as a member of a team? How do I overcome conflict? Those types of things. Just those are things that really can happen in a PE and a youth sports setting that really lends itself for those things. We talk about social emotional learning in a school setting, but man, in PE, there's conflicts, there's winning and losing, I've got to be a member of a team, I've got to organize things, I've got to problem solve. There's just some great places. So just like music, there's those ancillary things that really PE has a great chance to present.
Marty, I want to ask you more about your research in kinesiology and disability. You direct the KID Lab at the University of Virginia. What does KID, K-I-D, stand for, and what do you do in your lab?
Yeah, so our lab, Kinesiology for Individuals with Disabilities, so KID, we call it the KID lab. And so it's not like a physical lab like my colleagues have a exercise physiology lab or sports medicine lab or a concussion lab. So my lab is out in the schools. I'm out going and talking to parents, and I'm observing things. I'm going to youth sports settings and talking to coaches and talking to parents. So my lab is really way out in the world, doing lots of observations. A lot of my students do qualitative research, which is observations and interviewing. So interviewing teachers, interviewing paraeducators, interviewing children with disabilities, interviewing adults with disabilities to kind of retrospectively think back to their PE experiences and what was it like. We also do some training of PE teachers. So we've done a couple of studies recently where we tried to do an in-service to PE teachers to see if we can change their attitude and their confidence. So those are some other things we've done over the years too, a lot of the in-service training types of modules to see if it makes a difference. We've studied things ranging from attitudes, can I change your attitudes so you have a better attitude? I think we realize that, attitude is great, but if you don't have the confidence and the knowledge to be able to implement some things, you can have the best attitude. I think we should include kids. I just don't know how to do it. Well, that's not going to work. So we've been doing more with self-confidence, self-efficacy, which is confidence, and knowledge and competency. How can I make you more competent? How can I give you the tools and the skills to be more competent? So those are kind of the things I'm looking at, we've looked at over the years. But again, I think the biggest takeaway is that the theme has always been about including children with disabilities in general physical education and sport, and studying that phenomenon and looking at some of the key stakeholders, the PE teachers, the teacher assistants, the children, the parents, and find out what can we do to make this work better.
Yeah. Tell me more about some of these takeaways. What are some of the things that parents and caregivers tell you in your research?
Yeah. So I'm not sure how much research there's been on parents. I think that's something that's probably underserved, specifically in the physical activity, youth sport, realm there. So we did a study about 5 years ago where we interviewed parents who had young adult sons with autism. And we wanted to find out what are some of the barriers they have to getting their son or daughter physically active, and what are some of the facilitators, things that help them. Now I say sons and daughters, the group we had were all male. And they're all in their 20s, all living at home. And kind of a mix, a fairly severe, group, all special school type kids, things like that, or special classes. Anyway, some of the take-home messages I find fascinating were, not surprising, behaviors and sensory issues have prevented my son, or for me, for taking my son to the YMCA to work out. It's just too noisy for him, or to the local fitness center, or to join a sports team. We tried some youth sports, but it was just the social situation, it didn't really work for him. We've had more success with things like yoga, or just walking the dog in the neighborhood, or things like that. So those are some of the kind of the things in terms of barriers. They talk about behaviors, challenges. They're worried their child's going to have an outburst. They're worried that their child's not going to be able to handle the sensory situation. They've tried these things and they found it to be very difficult. The social situations, I think they find those to be challenging. The routines, I think that's been a challenge, as well as overcoming the I need to do A, then B, then C, and to add something new, like, hey, we're going to join the Y and we're going to start going to the Y, we're going to do this. That, I think those are some things they also point out as challenging. On the other hand, when they talk about facilitators, they talk about finding a college student or somebody who could accompany their son or daughter someplace. They found that to be very helpful. Again, they found individual sports, going for walks and hikes, have been better suited for their child with autism than joining a soccer program. Classes can work, quiet classes like yoga, Pilates, things that have quieter sounds in the background and more individualized movements. They find those things to be successful. Interestingly, I mentioned the idea of routines, and I remember one of the moms saying that her son, they did get him to walk on a treadmill in the basement or ride a stationary bike. And it started out with 1 minute and then 2 minutes. And now they're up to like 45 minutes. And they have this, a picture schedule that says, okay, we're going to have breakfast. After breakfast, you're going to go down to the basement and work out. And he knows that's his routine. And now he's, but the funny thing she said was, yeah, it's gotten so strict though that, if I only have time for him to work out for 30 minutes, he's like, nope, I got to be here for 45 minutes. And so, it could backfire a little bit too. So, so those are some of the things I think from a parent perspective we're hearing about. So things that can be barriers, also can be facilitators, establishing a routine, things like that. And I don't want to discount that team sports is not going to work for all children with autism. I think you have to know your son or daughter and see what works. I've seen lots of kids with autism doing soccer, t-ball, little league baseball, things like that. So it can work. Just you have to really know your son or daughter and what works best for them. And there's some research. One of my students and I did a kind of review of literature and finding things from yoga, Pilates, swimming, cycling at a gym, doing CrossFit, going to a gym and lifting heavy weights and doing kind of crazy things. All these things, the esports, playing, the kids with autism like the visual types of things. So playing esports where you're playing Wii tennis or those types of things where they're moving around. So there's lots of things you can do. I think the key for families is, okay, I really want my son or daughter to be physically active. There's an array of things that I've got to try things. And if this one doesn't work, then I've got to try something else. If swimming doesn't work, then I need to try yoga. If yoga doesn't work, let's maybe just as a family go for a walk after dinner. If that doesn't work, let's try something else until you find something that really, catches that child's interest. And again, I know kids in our community who love to walk and run, and they do that with their mom and dad. Others go hiking in trails. Some take their dogs for walks. And some are playing sports, doing Special Olympics basketball and tennis and different things, and they enjoy doing that. So just anything to get a child to be physically active is good.
I know you've worked a lot with Special Olympics over the years. What are some of the things that the public might not know about Special Olympics from an insider's perspective?
Now I'm part of a group that is doing inclusion, believe it or not, just like we talked about. But that's actually a big piece of Special Olympics. People picture Special Olympics as a bunch of children with intellectual disabilities all competing against each other, but they have unified sports where you have an equal number of athletes with and without disabilities on the same basketball team, same volleyball team, same tennis team. So they play together. So there's this really inclusive piece to it. They have Special Olympics is pushed into schools where they have inclusive PE. And they call them the champion schools, where the whole school adopts the idea of we want to make sure everybody feels welcome, everybody feels included. I'm going to make sure if someone's in the cafeteria sitting by themselves, I'm going to sit there with them. So these unified champion schools include this unified PE piece, the unified sports piece, but then also just, how can we get the whole school to be more accepting of children with disabilities? So I've had a little hand in that as well. So, and then, like I said, I've been coaching. I didn't, even though I've gone to more of an administrative role over the years being at a university, I still love, interacting and coaching children with disabilities. So I like I said, I do volleyball in the fall. I do tennis in the spring. I started back, I was doing some things at the international level and traveling, but I started locally when my older daughter said she needed to do community service and she played volleyball. And I said, well, let's have you volunteer for Special Olympics. You'll love doing that. And turned out there's no Special Olympics volleyball program in our community. And when I talked to the guy, I said, well, you want to start it? You start it, we'll do it. It's like, okay. So that's kind of how that happened. And then a couple years later, he said, our tennis guy quit. Will you start tennis? So we had 2 people who were playing tennis. I just left yesterday. We had 25 people playing tennis. So it's great. It's a lot of fun. It's a great way, being in a university town. I get university students to come and volunteer. We get some high school students, even as young as middle school. So yeah, I'm a huge fan of Special Olympics. I think they've over the years have grown, and they have a whole healthy athletes model, working on more healthy living. Just not physical activity and sports, but nutrition and eye care and all these types of things. So it's a terrific organization, and they are very welcoming of children and adults with autism. They're very accommodating, and I think that could be a good home. We have golf, we have tennis, individual sports, bocce, which is kind of like lawn bowling, so more individual sports. So it's just not the traditional track and field and soccer and things like that. So really great opportunities.
Marty, two final questions I wonder if you could weigh in on. First, what recommendations would you give to parents and caregivers of children with disabilities in terms of helping them to be active? And second, how can we learn more about programs for adaptive physical education like yours?
Yeah, I would say experiment. Try to see if your son or daughter likes, whatever. If it's kicking a ball, if it's throwing a ball, if it's going for a walk. I have a couple of granddaughters who love playing with bubbles. That might be a fun thing to move around. Just anything that gets a child out and moving, I think, is a positive thing. So to me, it's just kind of experimenting. And once you find even a small little sliver that the child seems to enjoy it, even for a minute, then kind of expand on it. So we did it for a minute today. Let's do it for 2 minutes next week and 3 minutes. And we're just going to keep on adding to it. And then build it into that schedule. If the children have these routines, okay, we're going to get up and have breakfast, and then we're going to get dressed, and we're going to go outside, and we're going to do this activity that we all enjoy doing together. We'll do yoga on the grass or something. We'll put a video in, and we'll watch something like that. We'll go take the dog for a walk. But build that in. That's on this child's schedule, so they know that they're going to do that. And again, expanding the time. So by the end of the summer, if you add, a couple minutes each day or each week, by the end of the summer, the child's doing 30 minutes of physical activity, 2 or 3 times a week. What a great thing. But again, I would say start slow, experiment, try different things, see what the child seems to like. And if you find that he likes one thing or she likes one thing, then see if you can't build that into their routine and just kind of add it on. I think that would work. In terms of adaptive physical education, there's only about 30 programs in the U.S. that train adaptive physical educators, so they certainly could look up my program. And again, we do call it kinesiology for individuals with disabilities. But yeah, I think it's a unique field. Depends on your state. Some states have trained adapted physical educators who will go from multiple schools to help the general PE teacher help some children. Other states, it's just all general PE teachers. If you're in a rural community, you might only have general PE teachers. If you're in a city, you're more likely to have adapted PE teachers. So just, there's lots of different things. But again, I think if you Google adapted physical education, you'll really find some good information about what we do and I would go to the IEP meeting and ask, hey, is there an adapted PE program in our school that I should know about? Hey, who knows? There might be.
Or like you and your daughter did, go out and start one.
Start it. That's a great point. Yeah.
Marty, thanks so much for the conversation today. It's been a lot of fun, and I've learned a ton.
Thank you for having me. I really enjoyed it.
You've been listening to my conversation with Dr. Martin Block, Professor of Kinesiology at the University of Virginia. Dr. Block directs the Kinesiology for Individuals with Disabilities Lab, or KID, at UVA, and you can learn more about his work by visiting the UVA website at virginia.edu. Thanks as always to you, our listeners. It's great to have you with us. I'm John Andrew Slominski with the Autism Annex podcast, and until next time, take good care of yourself and one another.